Namaste, Masters. I welcome you all to this session, part 4 on Dying to Be Me by Anita Moorjani. And we have learned so far that Anita, she has been living in Hong Kong, how how her growing years were like, and how she met her husband Danny, how she got cancer, how she went into the state of coma, had the near death experience, went out of body, had a direct experience of the astral realm. She met her father who had left the physical plane 10 years prior, and how she also met her best friend Sony. So now, Anita, she was back from the coma. She was back from the astral world into this physical world. She was there in the hospital. And now, Anita, she was finally out of the ICU. And her journey into the physical recovery had begun. Physical therapy was introduced so that she could build her strength back. Her muscles had got very weak. Her limbs had got extremely weak. They had lost all of the strength because Anita had been confined to a wheelchair for a long time. And so, slowly, step by step, with the help of the medical team and with her sheer determination, she reached a point where she could walk with the help of a nurse. And then one day, Anita, she asked the nurse that she be taken to the bathroom because she wanted to see herself in the mirror. And when Anita, she looked at the mirror, it took her breath away. She was very disheartened to see herself in such a long time. She could not believe what she saw. Her hair had almost gone. Her eyes had sunken into deep sockets. Her cheekbones were visible from the skeleton reduced face and body, and there were bandages on her neck, on her body, because of those skin lesions which were so wide, which were so deep, and they had to be covered with the bandages. And Anita, looking at herself, she began to cry. She began to cry not because of the way she looked. She began to cry because she realized that she had given so much pain, so much suffering to herself, which got her into this state. And that moment she made a promise to herself that never again would she subject herself to so much pain, to so much suffering. She made a promise that she would always honor herself, she would always love herself just the way she is. And then the doctors who were treating Anita, they were still trying to understand her state because for the medical fraternity, they had never seen anything like the case of Anita. They had never seen anyone coming back from death. They had never seen anyone come back from the end stage lymphoma, especially when all the body organs had shut down. And so the doctors thought that the best way of treatment for Anita would be to give her chemotherapy. And so the cycles of chemo started, and Anita saw that the nurses came in with those bags where the chemical, the medicine for chemo was to be given. And Anita saw that the nurses who were getting those bags, in those bags it was written in bold and capital letters poison. And Anita saw that the nurses, they were taking extra precaution that the chemical, they shouldn't even accidentally touch that chemical, or even they shouldn't accidentally smell that chemical. And Anita was wondering that the nurses are taking so much precautions while the same chemical is being administered to her directly into her bloodstream. And Anita knew that she didn't need chemo. For Anita knew that nothing could destroy her. Why? Because she had experienced the eternal truth. While she was in the astral realm, she had this knowingness that it was fear that was destroying her, that it was fear of not measuring up, of not conforming to the societal expectations, of not fitting in, of fear that she shouldn't get cancer, fear of death, fear of everything. So it was the fear that had got her into this state. And now, when this fear was completely gone, when there was no fear of anything, she knew that nothing could touch her. And that is how Anita, she agreed for the chemotherapy, and that is how the side effects of chemo, which we all know that there are some inevitable side effects of chemo, like dizziness or feeling fatigue, mood swings, and vomiting, feeling nauseated, and other extreme side effects. Anita didn't had any of those side effects, and she was just doing fine. So now the doctors who were administering this chemo to her, they wanted to know what dosage should be administered. And for that, they conducted a battery of tests and they suggested that a bone marrow biopsy should be conducted. And now, this bone marrow biopsy is a very painful procedure where a thick needle is inserted at the base of the spine so as to extract some marrow. So, what is a marrow? Marrow is a spongy tissue like substance which is present in some bones where the blood cells are made. So, this is then examined under the microscope. And when the results of the bone marrow biopsy came, the doctors were shocked to see that the results were clean. And they told that Anita and Danny that the results are very disturbing because they couldn't find any cancer in it. So Anita and Danny felt happy and told the doctors that you should be happy that the results came out clean. So the doctor said that no, this is not possible because cancer just cannot disappear like that. We have to find it somehow, and it's to us that we have to find it because cancer is present and we have to find it. So, they then suggested another surgery for Anita because they didn't want it to feel defeated. So now another surgery called as the lymph node biopsy was conducted. And the lymph node biopsy is again a surgery where an incision is made on the skin and a sample is taken out from the lymph nodes and it is examined under the microscope. So the results then came out. This time as well, there was no trace of cancer in the body. The doctor still couldn't believe it. That how is that possible? It's just not possible. So now the doctors wanted to conduct a full PET scan. So the PET scan is an imaging test where the images of the tissues and the images of the organs, they are taken and they show how they are functioning. So unlike the CT scan, unlike the MRI, which shows the structure of the body, the PET scan, it happens at the cellular level. So, it is very deep test and it shows the cellular activity of the body. So when the PET scan came out, again, the same thing, there was absolutely no cancer. And then, Anita, she had skin lesions throughout her body. Those skin lesions were so wide, they were so deep that a reconstructive surgeon had to be called. So, looking at the skin lesions, the reconstructive surgeon he said that a surgery will have to be performed so that all these openings, they could be stitched up and they could be closed, because there's no way that they could heal by themselves. But looking at the condition of Anita, the doctor said that your body has absolutely no strength. There is absolutely no muscle in your bony like frame. So we will have to wait a few days, and then just after a few days, a date was scheduled for the surgery. And when that reconstructive surgeon he came on the stipulated date for the surgery, he was astonished that those wide and those deep lesions, they got healed by themselves, that there was no need for the surgery to close those lesions. And all this while, when Anita she was going through the battery of surgeries, one after the other, when she went through the painful bone marrow biopsy, or the lymph node biopsy, or the complete PET scan, or the cycles of chemo, Anita, she already knew that she had healed from inside, that she didn't need anything of it. But since the world of medical science, since the doctors, they need proof, they need evidence of everything. Anita could not tell that she was there in the astral realm, and in the astral realm, she was promised that she would be healed, that there would be no cancer in the body. The doctors reject that claim outrightly. They needed proof of everything, so they conducted all of these tests. And Anita, she complied with them and didn't face any side effects from all of it. Why? Because she underwent through all of it, not from a place of fear, not from a place of that what the result might be, that they might find some cancer, or not from a place of having limited beliefs, but she went from a place of knowingness. She went she underwent all of this from a place of being an observer. And that is how she underwent all of it. Because, had a normal person would have underwent such painful surgeries, he would have felt overwhelmed with all of it. He would have felt so fearful of all of it. And, you know, but Anita, on the other hand, she was as calm, as composed, and that is how she came out so clean from all of the test. And now Anita's family members, they also could understand when Anita shared about her astral experiences, about meeting with her father, meeting with her best friend, about so much of the wisdom that she had got into the astral realm. So they were also quite intrigued by it, because they also hadn't seen anyone or even heard anything like this from anyone. So Anita's brother Anoop, he started researching about it in the internet, and he became aware that there is a website known as Near Death Experience Research Foundation, the NDERF website, which is a platform where people who have similar experiences like Anita, they share their experiences. So when Anoop he went through this website, so he saw that what experience Anita had. None of those people, they had an experience which was even close to that of Anita. So Anita's experience was rarest of the rare. And so in that website, Anita shared everything that had happened to her in a detailed manner. Everything, how she got cancer, how she slipped into coma, her out of body experience, her miraculous recovery, and her experience. It was promptly published in the website. And when everyone read about Anita's experience, especially the doctors, the oncologist, from across the world. For them, it was no less than a shock. And then there was this senior oncologist, a cancer specialist from the US. He became so much interested in Anita's story that he traveled all the way from the US to Hong Kong. He came to the hospital where Anita was admitted. He personally checked his medical records. He personally spoke with the doctors and the staff that was taking care of Anita, because for him also this was something unheard, unseen of. And everyone said one thing. All the doctors, all the senior oncologists, they said that whatever way we look at it, that whatever way we look at the records of Anita, Anita should be dead. So there is no way that Anita, there was not even 0.001% that Anita could survive. Everyone said one common thing, that Anita should be dead. And there were so many questions. There are so many questions which still remain a mystery. Looms. I will share my slides here. So, like her medical records, they showed that her organs, they had already shut down. So all her bodily organs, they had shut down. Then what caused them to start functioning again? Her kidney, her lungs, her digestive system, it had stopped functioning. There was fluid in her liver, in her brain, to an extent that Anita, she started choking in her own fluid. Then what restored their functionality remains unanswered. Anita had tumors the size of lemons throughout her body. Then how was it possible for billions of cells to leave her body so quickly, even when her organs had failed? So, from a biological standpoint, from a medical standpoint, this defies logic. That how could billions of cancerous cells, they could just leave so quickly, that just in 3 days her tumors could shrink up to 70%. None could answer that. Anita had skin lesions which could only be healed through a reconstructive surgery. Then how come they healed themselves even before the reconstructive surgeon could operate on them? There was no way they could heal themselves, for they were so wide and they were so deep. And then Anita was dead. You know, the medical doctors, they informed Anita's family members that Anita is no more. Then what flicked the switch? What made her body turn around from dying to healing? So, all these questions, none of the medical fraternity still has. And that is how Anita's experience is so rare. And this also tells us that we have the medical doctors, and yes, they are very important, for they perform the required surgeries, they administer the required medicines. But healing, you know, healing will happen or not, that the doctors cannot decide. Even after performing surgeries, even after performing those battery of scans, tests, administering medicines, they cannot guarantee healing. And now even the doctors, they have acknowledged this fact, that we are here just to perform what we can perform, but there is an invisible force which takes care of the functioning of the entire universe. Healing only depends upon that invisible force. You may call it as a divine intelligence, or the cosmic intelligence, or the creator, divine, or God. And there's so many examples of the doctors coming up and sharing examples of this. So now Anita, she was back from the hospital, and she was at her home since the doctors they couldn't find any cancer in her body. So the cycles of chemo they had to be stopped midway. And now Anita she realized that the world around her was not the same anymore. So, it's like the world didn't change. The world was the same, but Anita had changed. There was a complete shift in her consciousness. There was a complete shift in her perspective, for she had started enjoying, she had started feeling everything. She started enjoying the beauty of nature, the stillness of trees, the fragrance of flowers, the warmth of a smile, the cool breeze. She started enjoying little joys of life which we take for granted. And what got this shift? So, this shift came into Anita because there was a change in the place from where she was looking at the world from. Before her NDE, Anita used to look at the world from a place of fear, from a place of limiting beliefs and limitations. But now, having this newfound knowledge, she embraced this new understanding that life is meant to be lived with love, with authenticity, and with joy. So, the last 4 years of Anita's life, they had been revolving around the doctor visits, on being in the hospital, on following this rigorous health regime, on taking all the precautions and constant vigilance because her whole thought system, her whole belief system was revolving around that she should not die, that she should survive somehow, and she should be able to prevent the worst. And now Anita, she was completely cured, and now she wondered that what is she gonna do with the rest of her life? Because Anita, she had been an independent person. She remained busy with her job, and now Anita realized that she is no longer interested in doing the same job. And instead, Anita, she decided that she will prioritize her well being and her happiness over material success. And Anita now, she didn't care to socialize with friends. She didn't care to fit in any of the group. She didn't care to engage in the everyday conversations of everyday events. And she didn't care to please anyone for the sake of her happiness. And Anita, she could see that how people they are so caught up in the routine life, they're so caught up in the to-do list where one thing is checked, then the other thing looms, then the other thing looms. So, in following the checklist and in being so identified with the name, with the fame, with the role that they might have in an organization, with the title they might carry within the organization, and with how much they possess. So they're so much engrossed and entangled into satisfying their ego and in leading a superficial life that Anita could see that the joy of doing things, that the real essence of why do you work or why do you put in so much of effort in doing something. We do everything just to feel satisfied from inside. We do it to feel joy from inside. So Anita could see that there was no joy in everything that people do. And even we have seen in today's world where the world has become so fast paced, where social media has taken so much of importance, where how you look, where how you go for vacations, where how much you possess It has become so important than how you actually feel. Then that people are not even aware of what emotions they are carrying from inside. As long as the ego is satisfied, they don't care of how they feel, they don't care of what emotions they carry. And what happens as a result? With time, when we continue satisfying only the ego, we start being disconnected from our own self. And we go so far from our own self that later in our lives, one day we realize that why are we feeling so restlessness from inside? Why are we feeling so anxious from inside? And then we wonder that although we did everything we that we understood that we have to do, but we didn't enjoy it doing it. We didn't even know why we are doing it. It was just following the rat race. It was just because other people are doing the same, so we also have to do. So, Anita could see everything very clearly. And Anita could see that people are taking their lives so seriously. Whereas there's no need to take life and to take yourself so seriously, being so critical of yourself. There's no point. And Anita could see everything so clearly. Why? Because she said that one time she also had been a part of all of this. She had been once one of them. And now, when she's out of this world, so she could actually see because she has undergone everything what everyone else is doing right now. So this also calls as a reminder to us that if we have a very strict thought process, if we have a very limited belief system, and we think that only and only our thoughts are correct, only what we carry, what the beliefs that we carry is correct, then we will never be able to see what exists beyond this world. Because for us, only this world is true, and this world is the only reality that exists. So, that is how it is so important to be open to experimentation. It is so important to listen to others' experiences with an open heart, with an open mind. Only then we will be able to come out of the limited mindset and the limited belief. So, now let's understand what changed in Anita's life. What were the profound realizations? What, what she had when she came back from her near death experience. Now, Anita's husband, Danny, he always had this dream of starting his own business. So, Anita's husband, he always had been also doing a job, but somewhere in his heart, he carried this desire to start of his own, but the fear of what if I fail? What if my business is rejected? How would we be able to then sustain ourselves? So that fear always kept him from taking this plunge. But Anita, she motivated Danny that no, it's very important to listen to your heart and to follow your heart. It's so important to fulfill your dream because if you don't listen to your heart, if you don't fulfill your dream, then you would lead a life of regret. And nothing is more worse. There's no bigger a tragedy. So failure isn't a tragedy. Failure is that we don't even give a chance to ourselves to even try. So Anita encouraged Danny, and that is how Danny took this plunge. He left his job and he followed his dream. So, this is again a nudge to us that do we harbor any desire, any dream within us which we also want to pursue. And this is a call for us that now is the time to not listen to the outer voice, not be disturbed with the noises outside, that now is the time to take your plunge, because trying out is much, much better than have regret later. And another realization that happened with Anita was that Anita, she became aware of her ability to judge. We all judge at some point or the other that what is good, what is bad, what is right, what is wrong. And so Anita said that while she was in the astral realm, she wasn't judged at all for anything. She wasn't judged for what she did in the earthly realm or what she didn't do in the earthly realm or how she lived life or why was she consumed with so much of fear. She wasn't judged with anything at all, for there was just love, there was only compassion, love which was unconditional, love which was pure in its highest form. So, this again, it makes us aware if we are living with judgment, judging others, judging self. So it's very important that we accept ourselves the way we are, because only when we become completely and wholly acceptable of who we are, only then and only then we will be able to accept others the way they are. And when we start living with the acceptance mode, then this will naturally take the judgment business. And Anita realized that she no longer needs to fear anything. She doesn't need to fear illness, aging, financial loss, or even death. And Anita realized that when death, something which is seen as the most dreadful thing to happen, which everyone is so scared of, when that fear, the fear of death, goes away, then nothing can phase you. So, we all have this fear of death because our ego wants to remain alive. Our ego says that if you die, then your identity will also be washed away. But we know the eternal truth that we can never die. And when we start living from this awareness, then that fear of death will also go away. And once the fear of death goes away, then no power in the world has this power to shake us, to disturb us, or to intimidate us. And Anita also shared that it was because of her NDE, her near death experience, she realized that her internal world and beliefs shaped her external reality. So, before her NDE, Anita, she used to think that it was only the external world which was real and there existed nothing outside this world. And so anything that used to happen in the world outside her, any circumstance, any situation that used to make her tremble from inside. And that is how she said she used to become a victim to her circumstances, to her situations in life, and she gave away all the powers to the outside world. And that is how she used to live in a reactionary mode. That if the outside world is good to her, then she feels good from inside. If the situations outside are bad, they're hopeless, then she would also feel the same from inside. But Anita, after NDE, she learned that everything outside is just a mere mirror reflection of our inner state. So, what we need to work upon is our inner state because we don't have any control over the outside world. And when we are calm, composed from inside, once we start feeling this strength from inside, then no external circumstances, no external situation will have any power to disturb the tranquility, to disturb this peace which we feel from inside. And when I'm saying this, I know saying this, it sounds very easy, but with practice, with time, this tranquility, this peace, and this strength will come from inside. And then another profound realization which Anita shared was that Anita, she was brought up to believe that women should be submissive, that women should be subservient to the men in the family. That is, whatever men in the family they say, Anita, she has to follow it. And she should not be assertive about her rights. But after her NDE, she realized that, she can never be that person what others expect out of her. She can never be a domesticated wife. She cannot be a person, to whom if anyone says, okay, you have to do like this, then she would follow this. For Anita knew that she has a mind of her own and she would go only by what her heart and what her mind says. That is why God has given also her own mind and her own heart. So, Anita, she realized that there was no need to be ashamed that she is not submissive, that she is not subservient like everyone around at that time was. And for this reason, Anita, she used to feel so inadequate. She used to feel that she was somewhat flawed because she didn't meet the expectations of others. But now, after her NDE, Anita realized that there was absolutely no need to fulfill others' expectations. Why? Because Anita realized that she is here in this earthly realm not to comply with the expectations of others, but to listen to her own heart. Because what her own heart it tells, only that is true for her. At the end of the day, she has the obligation only to be true to herself. She cannot be true to all the people that exist in this world. She just can be true to herself, and that is only what is required out of her. And another realization which Anita had was that Anita, she used to think that she isn't spiritual enough and she needs to work harder in this area because Anita shouldn't went much to the churches or the temples, or she didn't used to follow any rituals or do chanting or offer prayers. So Anita, she used to have this in her mind that she is not spiritual enough because she doesn't follows all these things which are required to be spiritual. But after her NDE, Anita realized that we are all spiritual beings, regardless if we visit to the temples, church, gurudwaras or not, regardless if we offer our prayers or not, regardless if we chant mantras or not. Because we're all spiritual beings having this human experience. And another realization that Anita she got was that Anita, she needs to learn to trust her own inner guidance and intuition. And she found that by listening to her own inner voice, she could navigate life more effectively. When she was in the other realm, when she was with her best friend Sony, and while Sony was parting away from her in the other realm. Then Sony told her that go out and live your life fearlessly And the same words kept reverberating in Anita's mind when she was back in this earthly plane. So, all the time Anita could hear was, "Go out and live your life fearlessly, fearlessly," because it was fear which had taken away Anita's life. It was fear that had kept Anita back from living a life true to herself. And now these words that you don't need to fear anything, absolutely nothing, and you need to shine your light as brightly as you can. This is so important, and these are such beautiful words which I loved the most is, when Anita mentioned that that you are here in this world to shine your light, and you need to shine your light as brightly as you can. We when we take birth in this earthly realm, we're all given certain skills, certain talents, and instead of uncovering those skills and talents, we always look at the talents and skills of others. That, oh, she sings so well, I wish I could also sing this well. Oh, she dances so well, oh, I could also dance so well. So instead of nurturing our own skill, our own talent, we are comparing ourselves with the skills and talents that others have. There was this point, this phase in our lives where the career options, where there were just two career options, which was to be a doctor or an engineer. So, all the boys, they went being either a doctor or even the girls or an engineer. There was no third stream. So if a person wanted to do something else apart from being a doctor or an engineer, it wasn't taken in a good light. But now, with time changing, with people realizing that this world is a world of infinite possibilities, that we just need to focus upon our own selves. And this is what this it makes the world so beautiful when everyone shines what they are best at. And when we all do the same, then this would actually take away the competition from lives. This would actually take away the rat race which we are following. Why? Because everyone has been born with a certain skill set, and when everyone follows that, then they know that each and every being has its own place in this world, that there is no need to compete with anyone, because the other is following what they are good at, and you are following what you are good at, what you are meant to do in this world. So Anita, she learned that one only needs to listen to their inner voice. And once we start doing that, then we will see that all the life situations, all the life challenges, we will be able to navigate them effectively and effortlessly. And Anita, she realized that the reason she got sick, the reason she faced cancer for 4 years, and the reason she chose to come back into this earthly plane was that she had to serve as an instrument for healing to take place in others. When we read Anita's book, it touches somewhere in our heart. Anita's story, it tells us that we also need to live fearlessly, that we need to shine our light as brightly as we can. We don't need to fit in, we don't need to please anyone, we don't need to live with fear of any kind. So, Anita, she had this realization that she has to serve as an instrument for healing to take place, healing at all levels: physical, mental, emotional, and physical. And lastly, Anita also discovered that we're all part of one, that we're all interconnected. That is, we all have the capacity to heal ourselves. We all have the capacity to facilitate healing in others. Because when we get in touch with that infinite place in ourselves where we are whole, then illness, it cannot remain in the body. And because we're all interconnected, there's no reason why one person's state of wellness, it cannot touch others and help them on to their path of recovery. And by healing others, we also heal ourselves and we heal the entire planet. For there's no separation, there's no separation between you, between me, between everyone that exists around us. The only separation that exists is the one that we create through our minds. Anita, she then no longer operated from that limited consciousness. For Anita, she allowed herself to be an instrument where the divine intelligence, where the cosmic intelligence could flow through her, where love replaced fear, where surrender replaced control, where she trusted completely in the wisdom of that higher force. So, with this, Masters, we have come towards the end of today's session, and in this way, Anita's journey teaches us that the greatest healing begins when we return to love. Love for ourselves, love for life, and love for the moment we are presently in. So thanks you so much for tuning in for today's session, and I look forward to seeing everyone in the next session. And I open this platform for any of your sharings or any of your questions that you may have. And then we start with the meditation. So if we have any sharing, then you please unmute yourself and you can go ahead.
Sairam Ruchi Master, thank you so much for reading this book and narrating us the wonderful story. Are you able to hear me?
Yes, Dr. Lingeshwari, we are able to hear you, but we aren't able to see you.
Oh, okay, and camera is not switching on. Um, so really enjoyed this book, though I missed a few sessions. I'll try to catch up. And what I wanted to really ask, maybe all of you know, and I don't, is what was the process by which she healed herself? What I'm asking is, like, when we tell others you can heal yourself, that's not going to work. Mostly, anyone who hears that, I mean, right now I have a couple of people who are fighting with cancer and they are elderly. I wish I could tell them process to follow. I mean, they're all spiritual people. The two patients I'm talking about, they are very spiritual and kind, and they've always been generous. And it's not like they have any issues, but they are found with terminal cancer, and they're trying therapies. So, what could we say for such people from the lessons learned here? Thank you, Sarah.
Okay, so Dr. Lingeshwari, that's a very profound question that you have asked. And we have Malati ji here, who is a living example of whatever you are. So Malati ji, would you like to share your experience and answer to Dr. Lingeshwari's question?
Okay. Say I was going to the hospital for my regular mammogram. Okay. right? And this was during summer, and that was 5 years ago, 6 years ago. And I went for the mammogram as usual. Then they came back and they did it again and they did it again. And then said the consultant wants to see you. So my husband and I went into consultant's room, sat down.
Malati, you need to remove your hand from the camera.
Oh, sorry. I am always doing that.
Okay, yes, please go ahead.
Right? And when we went and saw the consultant, and he said, well, I got some news for you. You have cancer of the breast, okay? We have found some cancer cells, right, floating around, and we need to do an operation. Okay, right? So I was working at that time as a psychotherapy counseling for the NHS, right? So I told them, I can't do that, come now, because I got patients waiting for me to see. I can't just drop everything and come. They said, he said, is patient important and your health is important? You're coming next week for the operation. And you must remember, Bournemouth is the center for cancer center for Southeast and Southwest, right? So he was a very good specialist also. And I was admitted and the operation happened, and everybody, my brother was upset, my brothers were upset, my husband Vinky was upset, because my brothers have, and I have seen my mother dying of cancer. Okay. But I just gave myself up to the higher being, to God, and said, if he wants me to live, I will live. He is I got the best surgeon here to do the operation and treatment and everything. And he can, if he wants, he will work through his hand, right? And I will survive. If I'm not supposed to survive, then of course we know what would happen. That was my attitude, okay? And I said, it's all up to the higher being's decision, right? He has to decide whether I live or whether I die. And that's what I thought to myself. And I said the same thing to my brothers as well. And they said, how can you say that, you're so calm and so, very calm about the whole thing. How can you be so calm about it? I said, no, I am calm. I'm not agitated. I'm not upset. I'm calm. But at the end of the day, I told them, it is not in my hand. It's in God's hand. It's the higher being's hand. Okay. When I said that, hello?
Yes, we are able to listen to you. Yes, yes.
I and went and did the operation, and he said, on one side he did it, and he said, we have removed all the cells. We have even removed the glands from your under your arm and everything, okay, so that they don't spread onto it. And but we didn't see anything in those cells at all. And he said, I'll see you every year. And when I went off on the third year to discharge me, they did the mammogram and everything. And then he said, I want to see you again. You're coming back to coming back for another operation on the other side. right? Okay. And I told him, I told you to do both sides, okay, right? But you didn't want to, because why do an operation on a, when the breast is okay? And then that operation was done also. Straight away, they they asked me to come again the week after it was diagnosed, and had the operation. And of course, the treatment, chemo treatment, that was done at home. And there you are. I'm here now. I'm here. Well, I don't know how many years now, 10, 15 years. It's all in his hand. That was my attitude.
Yes, Malati ji, thank you so much for sharing your, profound experience. And, through Malati ji has gone through this terminal illness and through acceptance, through surrendering to the higher will, to the divine will, that she was okay, that whatever has to come, she's okay with it. So she allowed herself to whatever is meant for us, for her. She allowed that to follow. She allowed that healing to happen through her. So she was open to any of the consequence that could come. So, Dr. Lingeshwari, what we learned from this session is that when we come across any person who is also going through this terminal cancer illness or any other illness, then we need to show them love and only love, so that with this love they start loving themselves the way they are. Even in the midst of illness, they start loving themselves, they start accepting themselves the way they are, and they have so much of love and so much of acceptance in them that they realize that whatever will happen will be the best for them. So,
Yes.
Thank you, Master Ruchi. Thank you so much. I'll pass on all that we learned to the patients who are currently fighting cancer. Thank you so much.
thank you.
Lingeshwari, it is not about fighting the cancer, okay? It's about doing what you can for all the treatment and then leaving it to the higher being, to God, to decide what he wants to do.
Sure, sure, sure. I agree with that. It is an expression, if to say fighting cancer.
Yes, I know.
And both the patients are very spiritual people. They've been very kind to
Mm.
everything or in whatever they did, and they understand that concept. I'm just going to reinforce that concept to them in case,
Yeah.
uh, when you're ill, you can't remember all the points and things. So sometimes
Yes.
you need reminding. So I'll do that, and I'm praying for them. Let's see.
Yes.
Yes. Thank you so
Yeah.
much.
Thank you.
Can I share something?
Yes.
Please, Sara ji, please go ahead.
Yeah, I had an acquaintance who was a cancer patient, and the first time she had cancer, she was not doing any meditation. But the second time when it came again, she started doing meditation, and it seems that really helped her. And she was doing meditation for almost 4 hours and 7 hours. So I said, "How did you do it?" She said, "Of course, I had cancer, so I had no other option. Like it was either do it or
Yeah.
don't, suffer." So, and she's cured, she's absolutely healthy now. So, I think meditation really helps, but you have to put in those many hours.
Mm.
Mm.
So, so because of a second time when she got cancer, because she was meditating so much, she had no side effects of chemo. Can you believe it? And all the other patients who were had with her, they were all saying, "What are you doing right?" Because we are having so much of side effects because of the chemo. She didn't. She had none, and she was suggested 6 chemos. And after the fourth chemo, it seems her cells, because she was meditating, she got the vision that the cells are saying we can't take it anymore. You know,
Mm.
So she communicated this to the doctor, but the doctors are not going to listen to all this metaphysical thing. So, but she was quite insistent. She didn't say, I'm seeing this vision all along. She said, my body cannot take it. I cannot handle any more chemo. So they said, okay, let's give it a break for 15 days and then we'll do some tests and then we'll decide. So they gave a break for 15 days. Then after that, they did some tests and the test came out all everything was clear, and then they couldn't believe it, so they did another body scan, that was also clear. So that's how powerful meditation is. It can really help, but then it's very essential that you do it for long hours. So this is a very real life story. I just heard it about 2 months ago. Yeah.
Thank you.
Yes. Thank you, Anaji, for sharing this real
And
life experience. It also gives motivation. Yes, you want to share something else?
yeah,
Yes.
in another meditation group, a girl was saying her father had blood clots in the brain, and he also cured himself. And that time she didn't say how many hours he was meditating. Later, she said he was meditating for 10 hours, and all his clots were gone. So you
Very
need to
powerful.
go to that extent, yeah. But obviously, you will do it when you know you're either going to die or. So when you're only in that desperate situation, I think you will get the power to do it also, I think, for 10 hours then. Yeah.
Yes.
Mm.
Yes. Most of the times the challenges come so that they can take the best out of you, which you aren't even aware of. Can a normal person think of meditating for 10 hours? Not at all.
No, no.
So, this challenging situation, this do or die situation, it gave all the strength to uncover what potential lie already in that person.
Mm.
So, yes, thank you. So, Masters,
I have to tell you, at that time I was doing transcendental meditation. I learned there was a transcendental meditation center in Bournemouth. So I learned from them and I was going for the sessions. But I was not doing 10 hours, and they said 20 minutes, 25 minutes. That's all they said to do it. So I was doing that as well. But my faith in the higher being was very strong.
good, good, great Malati that even in that dire, extreme situation, you were able to keep your faith up. This is also a very big thing that most of the people they start to question God. That why did you put me in this situation? That why me? Why do I have to face this? But keeping faith and trusting,
Mm.
it's so quintessential what you did, Malati. Yes.